Hey guys, welcome to my YouTube channel. So today we're going to be talking about vaginal yeast infection. Over the years, this is the most common type of infection in women. Over 80% of women has experienced it before. I have experienced it before, and I must say the first time of it occurring to me was pretty terrifying. Like, I was so scared. So the good news is it is not a sexually transmitted infection because you can get it with or without sex. So if you have a yeast infection, make sure you're protected during sex or before you get sexually active. It should be treated. I guess your partner would understand. So I'm going to be using the acronym VYHI to make it pretty easy for us all. The vagina consists of healthy bacteria such as lactobacillus and the likes, which keeps the vagina in check. You must have been wondering what microorganisms causes VYHI. Well, it is called Candida albican, which is the most prevalent cause of VYHI. So once the growth of Candida supersedes the healthy bacteria, there is a disturbance in the vagina, and you begin to feel irritation here and there in the vulva and the vagina. Apart from the fact that most women are prone to this infection, there are some factors that increases your chances of getting VYHI. The use of excessive antibiotics. It kills a range of bacteria, including the healthy ones. So at this point, the Candida has little or no healthy bacteria to compete with and would spread pretty fast. So reduce the intake of that antibiotics. You know what I mean. Pregnant women are also at a high risk of getting VYHI because of the increase in their estrogen level. Women with diabetics and also women with lowered immunity. Apparently, the first set of symptoms you would get is extreme itchiness in and around your vagina. Oh my goodness, this is super embarrassing. Plus, most women tend to ignore this particular symptom. They believe it to go on its own within few days. Please don't ignore such. Visit your gynecologist. It would be in a better position to help you out. However, other symptoms include pain when urinating and during sex, soreness, burning, redness, and swelling of the vulva and vagina. Some experience a watery vaginal discharge, while some experience a thick white vaginal discharge that looks like a cottage cheese with no smell. I know someone is listening to this and is experiencing one of the symptoms. Please visit your gynecologist and get proper treatment. The questions running through your mind that how can I prevent this super annoying VYHI from reoccurring? Here are a few tips. You have to avoid douching. You have to avoid scented feminine products like spray, soap, bubble baths, and the likes. You have to avoid wearing tight-fitted pants or pantyhose to avoid heat and moisture in the genital area. It is advisable you wear cotton underwears. Avoid using a pad or tampon for a long period of time. Most especially, after using the toilet, wipe from the front to the back and not vice versa. You don't want to bring bacteria from the back to come mess up your VJ. This brings us to the diagnosis of VYHI. A pelvic examination is done by the gynecologist to look up for any swelling, redness, or discharge. A cotton swab would be used to take samples of the discharge, which will be checked under the microscope for any sign of an undergrown fungus Candida. Note guys, your doctor's opinion is the ultimate and most important. Whatever information you get here is based on research. Are we clear? So that being said, you can get anti-fungal medicines which comes in form of creams, tablets, ointments, and the likes. Drugs like that include teraconazole, meconazole, etc. It is safe to use over-the-counter medicines, but with proper prescription from a gynecologist or a pharmacist. Pregnant women are advised to use antifungal creams or suppositories which is inserted in the vagina. Oral use of antifungal cream can cause birth defects. So after 2 to 3 weeks of treatment, do we follow up to ensure that there's no sign of VYHI? However, some prefer to use homemade treatments such as boric acid, coconut oil, tea tree oil, garlic, and plain yogurt. Some insert the plain yogurt inside the vagina. Personally, I don't think it's advisable to do such. Some of this homemade treatment has been tried and it works for some people. Irrespective of it all, try to know your body type and what suits you before using any of these homemade treatments. So that's it guys. Don't forget to like, subscribe, and drop your comments in the comment box below. Thank you. Bye.